All right, so I guess we'll go ahead and get started. So my name is Autumn Sipis. I'm the Marketing and Outreach Coordinator with the Canadian Coalition for Green Healthcare. And on behalf of the coalition, I would like to welcome you to the first of our Green Hospital Scorecard, Top Performers and Green Hospital of the Year award presentations. Before we start today, I just want to acknowledge with respect the Indigenous peoples and communities whose historical relationships with the land continue to this day and on whose traditional territories our work takes place. Throughout the webinar, please use the chat function for any technical issues you may be experiencing. Use the Q&A function for any questions you have regarding the presentation. And myself, my executive director, and our panelists will be answering those questions at the end of our webinar today. We will also be recording this webinar, which will be sent to all of our registrants and will be available on our website at a later time. So I will now hand things off to the Coalition's Executive Director, Neil Ritchie, to begin the presentation.
Well, thanks very much, Autumn. I'm Neil Ritchie, the Executive Director of the Canadian Coalition for Green Healthcare. I'm delighted you could all join us today. With all of the bad news in the world, it's really nice for us to pause for a moment and celebrate the success that we're making in the greatest fight of our lifetime, really the fight against climate change. Today, besides my colleague Autumn, I'm pleased to be joined by Alan Kelly, the Manager of Infrastructure at Holland Bloorview Hospital, Elizabeth Perlaskowski, who's the Program Manager for Sustainability at the Hospital for Sick Children, and Ian Rogers, who's the Senior Director of Facilities Management at Holland Bloorview. They will be telling us a little bit about their how they've achieved some success in the program. And first of all, I'd like to acknowledge support from Save On Energy, who sponsored the program for a number of years, and also for all the participants that we've had in the program as well. Today, in terms of our agenda, we've got I'll give you a little bit of an overview of the scorecard and updates of sort of where we are, and then Autumn was going to talk about some of the data that has come out of the scorecard program, and then we'll go into our awards ceremony from there. So as most of you know, the scorecard has been around for a while, but because of the pandemic, we had to, this past year, integrate a couple of years, put a couple of years together. So last fall, we had a call for data for both 2019 and 2020 data. And then in May of 22 this year, the scorecards were distributed, and now we're into the awards. Our coalition is committed to working with our hospital partners to benchmark environmental sustainability, not only in hospitals, but also in the long-term care sector. We'll be moving into that sector next year, and we're going to be announcing next steps for the Green Hospital Scorecard in the next several weeks. So stay tuned for those announcements through our digest, and we'll be reaching out to the current participants directly. Okay. The scorecard is made up of a number of different categories, actually 10 different categories, as you're probably aware. But only 5 of those sections are weighted towards the final score. Those include leadership for 20%, energy 40%, water and waste 15% each, and policy planning and pollution at 10%. So other sections don't contribute to the final score, but they're really important. And we do continue to add categories as time goes on. I'll turn things over to Autumn now. We'll talk a little bit about the results that we have this year. Autumn?
All right, there we go. Okay, so just to reduce any confusion, I'm going to be going through some of the averages of our results through this year's scorecard. And so we're going to be looking at the 2021 Green Hospital Scorecard, which is looking at the data for 2020. I have not included the data from 2019 because we didn't have a ton of responses. So we didn't get enough data to have really significant information in terms of averages. So that's why you guys didn't receive a scorecard specifically for 2019, even though you still are able to see your 2019 data on your 2021 scorecard. So I will be comparing our 2021 scorecard with the data from the 2019 scorecard, which looked at data from 2018. No, it's a lot of numbers. It can get a little confusing, but just let me know if you guys have any questions, put it in the chat if you need any clarifications. So this is a brief overview of our scorecard participants from this last round. So as you can see, majority academic, but still pretty good response from the other groups. We had a really good increase in participation for the 2019 Green Hospital Scorecard. We only had 83 participants, which was partially due to COVID. It had gone down from our 2018 scorecard. So this past year we had 99, which is great that we're back up to the levels that it was pre-pandemic. So as you can see in this graph, we've seen a steady increase of academic hospital participation. There's been a steady increase for them. And it's interesting because we've seen a steady decrease from the community hospital participation. So just something interesting that we've been thinking about. So this is an interesting facts for you guys. So for our total site area this year of all of the hospitals, about 6.4 million square meters. For the average site area, 21,895 square meters. So both of these, the average and the total site area has gone up from the previous year, obviously to our increase in participants. So, and as well, for the 2019 total site area and average site area had been down from 2019 or 2018, of course, because of the reduced participants. So this is a graph showing the water use intensity comparison. Water use intensity is the water use in cubic meters per square meter of area for the site. As you can see, the academic and small groups saw a slight drop in water use intensity from 2019, while community and non-acute saw an increase. And I just want to take this opportunity to remind everyone to make sure when you're doing your survey to double check the unit you're putting with your data. Having the wrong unit can not only affect your own scorecard, but can really drastically impact the averages for the scorecards as well. I had to reach out to quite a few people to just confirm their units. So just something to keep in mind for next year. Okay, so this is our the blue bin waste as a percentage of the total waste. So looking at what percent of waste is actually being diverted to recycling. Aside from small hospitals, we saw every other group have an increase in the percent of waste being diverted to the blue bins when compared to the 2019 Green Hospital Scorecard. And we saw a huge increase for non-acute. So congratulations to those sites diverting a lot of waste. But it's really great to see over time hospitals gradually increasing their flow of waste into recycling and other waste diversion areas. Okay, so leadership and corporate commitment. In terms of leadership, these are some of the things we look at. So, a corporately recognized environmental mandate or commitment, an executive champion accountable for overall hospital environmental strategy, a dedicated FTE, and a green team. Um, so, while we take into account other questions, these are probably the most important for our calculations in terms of leadership. So on the right side, you can see our average leadership scores for each peer group. These are out of 100, so you can see there's definitely room for improvement. But I would like to acknowledge that a lot of sites had some really, really high scores, which you'll see later in the awards. And we also saw a lot of sites had improvements from the previous years. But in spite of this, there was a lot of low scores, which clearly brought down the averages quite a bit. So for pollution prevention, we look at three things, which you can see on the left. So environmentally preferable purchasing, toxin management, and sustainable construction and renovation. And we take into account three things within each of these categories. So whether you have policies, specific targets, and action plans. Having each of those three things actually influences your scores and can change your ranking on your scorecard. So the same kind of situation happened here with pollution prevention as it did with leadership, where we had lots with high scores, but lots with low scores. So as Neil mentioned earlier, leadership is worth 20% of your overall score and pollution prevention is worth 10%. So we did have quite a few people that didn't respond to those questions. So just keep it in mind that it can affect your ranking and your scores. So something great to notice here with this graph is that everybody increased from the 2019 Green Hospital Scorecard. Everybody's pollution prevention scores got a lot better. So that was really, really great to see. Okay, so now I'm going to hand things back off to Neil to go through the awards.
Great, thanks, Autumn. So okay. The first category of awards are for leadership. And I'm pleased to announce the leadership winners. But before I do that, I just wanted to mention the fact that Health Services Organization and Accreditation Canada Health Standards Organization and Accreditation Canada have come up with new environmental stewardship requirement standards for hospital boards and leaders. And so this is going to become an increasingly important category, I think, for everyone in future. Okay, the winners, first of all, we have four peer group categories that we're going to be mentioning today: the community group, academic, non-acute, and small group hospitals. And the honorable mentions are here. I'm not going to read them all off now for the sake of time, because I want to allow some time for our presenters. Sure, and here are the winners, and as you see, a number of academic winners basically came out at the same score. So there you are. Congratulations to you. And okay. Okay. Sure. So water award winners, sorry about that. There you see the honorable mentions. I'll just let you read those, and then Autumn and the winners. And we're going to be hearing from Markham Stofield in a minute. Great. And in terms of the waste awards, first of all, we have our honorable mentions. And here are the winners. Congratulations. For pollution prevention awards, here are the honorable mentions for each of the peer groups and the winners. And the most prestigious award of the year is the Green Hospital Scorecard of the Year winner. Honorable mentions in those categories: Northumberland Health, Hills, South Health Campus, Women's College, and Geraldine District Hospital for the honorable mentions. And the winners are Royal Victoria Regional Health Center, Hamilton Health Sciences, Ron Joyce Children's Health Center, Holland Bloorview Kids Rehab Center, and Four Counties Health Services. So congratulations to all of you. Great. Okay, now we're going to hear from some top performers. First of all, from Markham Stofield, we have Alan Kelly. Take it away, Alan.
Just give me one quick sec, Alan. I'm going to give you control here.
All right. First of all, Autumn, Rick, Neil, thank you very much for hosting this. We're very happy to accept awards for what we won. Like I said, getting awards is always great. It's good for the team. It's good for the senior leader, our senior leadership team. They like it very much, and you know, it's great to it's great to get these awards, especially after just getting, you know, with COVID and everything. So. Okay. All right. So, so we're called Oak Valley Health now. We used to call Markham Stouffville Hospital before. We still are Markham Stouffville Hospital, the Expert Center, but our umbrella is called Oak Valley Health. We also have the RCC, which is part of the Humber River Hospital. So this is the services that we provide to our community, and this is our team. And when people ask me, how big is your green team? I say, well, we have 3,039 staff, and we have volunteers and professionals. So this is, you know, a bigger group, because these are the eyes, the ears, and the nose of the facility, and they're the ones that call us when the, you know, the taps are dripping, or the lights are not working, or lights stay on. They're the ones that let us know this information, which is great, because these are the quick hits that we can get done right away, and, you know, save some good water and some energy. So goals, everybody has goals, and we have goals in our pollution prevention, which, you know, includes water, waste, and everything in the hospital. We find, or we think that pollution prevention starts at the loading dock, especially when products come in. You know, we always ask, you know, do you recycle? Do you take back the cardboard? Do you take back the skids? Do you recycle everything? You know, energy efficiency. So all those questions are asked, especially through our procurement. So here are some of our accomplishments. I'm not going to read them all out, but I think what I want to base them on is the when we built the building B, we ensured that the materials that were being used to build a new wing, which was constructed in 2011, that it consisted of low VOCs, was energy efficient, was recycled. And that helped us get that building up to a LEED Silver building. So we're very proud of that. And since then we've been doing a lot more energy, and so we're probably within the next couple of years we're hoping to get that up to gold. These are some of our stations that we have across the hospital. We use 100% recycled paper towels. We have a microfiber system that minimizes water used by housekeeping. In our centralized department, scheduled database informs the VS to shut off the lights after cleaning. That's been a real big help, because once they go into an area to do their cleaning, they make sure that the lights are turned off. And then a PPP recycling program. So in plant maintenance, our hospital now has gotten almost 90% of LEDs. We have 2 lighting systems. Actually, we have a green gate that controls the lightings in the offices and the hallways. We also have an insulating product that we installed a couple of years ago. And what that does is controls the lights in the hallway, but it also has heat mapping. It can be used for wayfinding, so there's not just light harvesting from the fixtures, but there's lots of other things that we can use for that. So, and it's working out very well. It's like when you're in Europe and you go to a hotel, and as you're going down the hallway, the lights come on, and as you're looking back, and the lights go off, right? So it's very unique, and the staff kind of found it unusual at first, but now they're used to it. So we love winning awards. As you can see that winning this awards is great. We'll be publishing this after today, and our newsletters, and we'll be posting on our web and our social media sites. We won the Ontario Waterworks Award in 2020, and here's my director, Maria Pavone, and myself accepting the award. Unfortunately, they didn't have a conference, so we couldn't accept the award at the conference, but it's okay. Again, we were 3 years in a row recognized by the Green Healthcare, and that's with 5% lowering our energy efficiency. But what happens is every time your 5% gets reset, so then your targets get higher. So that means then you got to save more energy than the next year, and then if you do the 5%, and you got to save more energy the next year. So it's just not that you just save 5%. So in 2000, I believe it was 18, that we won the Canadian Coalition for Green Healthcare. Well, that's this year's pollution prevention, but we also won it in 2018. And then we won other awards such as the William McClellan Award, sponsored by Chess for Energy Efficiency, and the Canadian College of Healthcare Leaders Energy Award. So then, we encourage and participate in a paperless initiative. We use double-sided printing, fragrance-reduced workplaces. We use greening tips in our bi-weekly newsletter that comes out on the web. We don't print anything. And like I said, if you look up at the corner, that's their LEED Silver rating for Building B. So it's very important to when you have the staff and the community involved, especially when people come into your public spaces. It's their public dollars and they want to make sure that you're using their money wisely. So we try to promote as much as possible energy efficiency and to say that we're using your money wisely. We have our greening initiatives and energy posted on our website so the public can see it. And like I said, we very big on staff engagement to make sure that our staff are committed to energy efficiency and pollution prevention. And we have also a HOV parking lot, and if you carpool, then you get the park closer to the hospital. So we're also partnered with the Cornell Community Center, and that's built. There's a walkway built right onto the hospital, so our staff in the morning can go out and work out in the gym, and then come to work, or we can go from our hospital to use the library. They also have a big swimming pool there, so. And it also got us some lead solar point, lead points too for the new addition. So it's a win-win. They got a big library there too, so we encourage the staff to go there. We have events, ever since COVID has hit, we've hadn't had too many, but once we start, hopefully one of these days, get away from the mask, and we'll start bringing those things back. But we have our annual, cleanup for Green Day or Earth Day. We have our bike to work where staff can bring in their bike and get them tuned up, and we usually have then a draw for the giveaway bike to one of the staff members. We have our annual Greening Sustainability Expo, where we bring in different exhibitors and that's partners that we have a lot here in the hospital that we work with to showcase how they support the hospital with green initiatives. As you see here, some of the pictures. We have booths set up. Some of the vendors bring in flowers. Last year or a couple of years ago, there was one that brought in. It was almost like seeds that were in a paper cover, and you just throw them into your ground, and all of a sudden, a couple of weeks after, you'll start getting flowers. Then again, presented with the, I believe that was the Commute Work Award. Water efficiency, is very big. So I'll explain a little bit about the, how we saved a lot of water in our physical plant. We had a process loop, and that process loop was no, we didn't have a process loop. Actually, we had fridges and freezers that were tied into the domestic potable water system. Because when we go back in 1988, they didn't really worry about, they sort of just build you a flat rate. And, sometimes it was better to use domestic hot water, save a little money on the chill water. Well, then they started metering, and then they started to charge us for the water. But then we forgot to put back the domestic units for the refrigeration and the freezers back to a chill water loop where they can be recycled or reused. So, and this was actually, it was brought up by the staff, so we acted on it very, very fast. So what we did is we disconnected the domestic potable water systems from refrigeration, fridges and freezers, and what we did is we put them onto a chill water loop. Now, some of the systems were also on the chill water loop, but it was a big chill water loop, and we used 240 horsepower pumps in order to push that chill water through the system. That was only requiring probably about a 10-ton load. So that was very inefficient, especially in the wintertime when we don't use chill water for the air handling systems where we use a lot of outside air. So then we took those off the chill water systems, and now we have just pipes for a process loop. So now so those once true units are no longer, and now what they do is they use chill water from American Mystic Energy plant. We get the chill water here at the facility 24/7. So, and this gives us the ability also to shut down the two 40 horsepower pumps in the wintertime and use two 7.5 horsepower, and only one pump runs at a time. So you're going from using 80 horsepower of pumps to just one 7.5 horsepower. So it was a big savings on energy and a big savings on water. We got a $50,000 rebate from York region, and I think it was about a $78,000 rebate from Save on Energy. So I think that project had about a 3-month payback. So that was very exciting. As you can see here, I only went to September, 2020, but the water keeps decreasing, and when you look at it here from January to May, we were in the commissioning phases then, so you can see that if your blue line is below the red line, you're doing really good. Like you're saving big bucks, right? So this was the bit of our commissioning where we're just getting the systems ready, and we're doing trial and error, but this is where we started to really save the money. And it was around the middle of May, and like I said, we've been saving money ever since. So, and like I said, it's been showing with the awards from the OWA and the Canadian Coalition. So that's great. Here's the pumps that we used to use. Now we shed these pumps down in November, and they'll start them up till probably April. And these are the pumps that we use now. We only use one of these at a time. So that's like it's a big saving on horsepower. It's a big saving on the chill water loop. And we're not, putting potable water down the drain anymore. And here's a picture of the unit that we converted. And you see here, this is the potable water coming in. It goes through the coil. And from the coil, you see over here, it goes down to the drain. That's those, these things are calling because these are in the elevator machine room. So it gets hot in there. So these ones are probably on a lot in the summer and the winter, right? So, but that's just a steady stream of water going through the drain. This is what we have now, and it's a chill water system. And you can see here, supply comes into the coil with the control valve, goes through the coil. And then here it then goes back to the return system to be chilled again. And this is just a drain from the pan, and now it just goes to the drain. So no potable water is being wasted. And I believe that's the end of my presentation. Yes. Thank you.
Great. Thank you so much, Alan. I think we're going to hold the questions to the end. And I'll now move to Elizabeth Perlikowski, who is the program manager for sustainability from Sick Kids. But congratulations again, Alan, and thank you for sharing those great success stories.
Thank you. No, we're very proud. And like I said, that it starts with our people, right? Our frontline staff, like they're the ones that bring us the ideas, and we're the ones that make it happen. So
super. Okay, thanks.
Hello, everyone. Thank you, Neil. So as Neil said, my name is Elizabeth, and I'm part of a team. Oops, someone's changing. Okay. So I'm part of a team here at Sick Kids that focuses on reducing Sick Kids' environmental footprint. And my colleague, Alan, who I didn't think was able to join, is one of the attendees at this session. So just a little bit about Sick Kids. We're in an academic hospital. On average, we have about 300 beds used every year. There's also a research facility with about 250 labs. We are in the space of pollution prevention. So our research facility has achieved 3 LEED Gold certifications for new construction, for commercial interiors, and for operations and maintenance. And they have influenced how we are approaching pollution prevention across the campus and at the hospital. And I'll speak that during my presentation. SickKids also is building there's a lot of new development taking place. Next year, there's going to be a tower opened that will have training, education, as well as offices. And it's going to be going under quite a bit of renovations and demolitions for a good 10 years before adding another 144 beds by 2035. And there'll be a new hospital added to the existing hospital. So, oops. So we were one of the top performers and received a mention in leadership, pollution prevention, and water. So I will just speak to what we've been doing in this space, some pretty detailed and some pretty high level. So let's start with leadership. So we do have executive sponsors. Our VP and a CFO, as well as a VP of transformation, are our executive sponsors, our green executive sponsors, and our VP of transformation is also oversees the new development that is taking place at SickKids. And I forgot to mention that not only our research institute has received a 3 LEED certification, but our new builds as well are pursuing LEED and LEED certifications. Going back to leadership, we have our executive sponsors. We have a strategic plan that sustainability is part of the strategic plan. It's under building an academic health sciences center for the future. And there's a component embedded in this part to mobilize a green friendly organization. The strategy before that, we also, sustainability was part of it, that focused on socially responsible SickKids. We have, and this is a typo, 2030 and 2040 sustainability goals for energy, water, waste, and greenhouse gas emissions. We report them on a monthly and a quarterly basis, as well up to the senior management. There's a program at SickKids called Kids Go Green. It's been here in place for over a decade. That is dedicated to reducing the organization's environmental footprint. The program is supported by myself and my colleague, but as well there's our manager, as well as a director of facilities and sustainability, as well as a number of volunteers. Our policies and plans includes an organization-wide environmental policy. It's a statement that has been implemented and is found among all the other policies and plans at SickKids, because we have the 5-year energy plan that includes our energy and water goals. But as I mentioned before, we are influenced by LEED, operation and maintenance certifications, especially when it comes to our policies and plans in the pollution prevention space. And I'll discuss that a little bit more. We have green teams hospital-wide at the research facility. We also have green teams where we're departmental green teams that we are also part of. And currently it's in the OR and CCU, and they're fairly active. Our energy and sustainability, budget does include the utility costs, the waste disposal costs, but also focuses on education, outreach, and how to support some initiatives. We're in the process of drafting our 5-year plan and a sustainability strategy. And the 3 directions that will focus in our sustainability strategy will be climate action, which includes climate resiliency, operate for tomorrow today, which focuses on what we can do in the space of utility use, supply chain, travel, as well as waste reduction today that'll reduce our environmental footprint in the future. Mobilize a green-friendly organization is a direction that focuses on cultivating a sustainable, a socially and environmentally responsible culture at SickKids. Moving on to our pollution prevention, I was planning to kind of give you an overview of some of our green pollution prevention policies and plans and our approaches, and also discuss how we've been using pollution prevention P2 plan, which is kind of mandated by the city of Toronto to further reduce our how we manage toxins. And one area that we are focusing on, and we've been struggling and have a plan in place to improve, is our disposal of biomedical and pharmaceutical waste. So I'll just touch base on that, as we're pretty active in this space. So for pollution prevention, we have an environmentally preferred purchasing policy and green cleaning policy. Green cleaning policy does have purchasing guidelines. That's why I've included here. And we are also developing other policies that came out of the lead operation and maintenance certification at the research facility. So all of these policies were first introduced at our research facility, and our strategy, and we've been working through it, is to expand these policies and make them sick kids wide, to include the hospital and any new builds in the policy and the plans. So I'll provide examples from our environmentally preferred purchasing policy as well as our green cleaning policies, just to give you an idea of how we're doing, setting up our targets and tracking on what we're focusing on as well. And I've just listed out some of the other policies that we already have them in place. We just need to expand them across the and to make sure that it includes the entire campus, that deals with pollution prevention, from solid waste management, the integrated pest management plan, which, when our experience at the research facility, definitely had changes in some of the chemicals we used and some of our practices. Building exterior and hardscape management plan, focused on how we clear snow, what type of silt we'll put in, how much silt we'll put in, and when we will start clearing for snow. At the research facility, we don't have a lot of, actually we have no landscape. So that's something we would need to expand and include on how to manage that sustainably when we're going to be expanding the policy to include all the other buildings. And cooling tower management plan, I think it falls under pollution prevention. The focus in the plan is on using, the coolants that have less global warming potential. We're also part of we also are able to provide sustainability input during capital reviews of all projects and during purchasing products, which help us embed the requirements, the sustainability requirements that are found already in the preferred purchasing policy and the green policy, and other plans that we have at the time the purchases are made. So a little bit more about our environmentally preferred purchasing policy, and we've referenced the Canadian Coalition template. We've reached out to other hospitals to learn on how to best approach it, and we also referenced the LEED certificate, the LEED principles, and some of the requirements. So the policy is meant to guide purchases at a department, individual, or organization level towards more socially and environmentally responsible products. We have appendices which list verified third-party green labels for products, and also have hazardous substances that we are encouraging for staff to make sure that they check if they're in the products at the time of purchasing. And this is our scope. At the moment, that for the preferred purchasing policy includes, we have at the research facility, our experience was that to track them, it's quite an effort to track the percentage of any of the products that meets the criteria. So we haven't had goals at this stage, but we had discussions about how we can adjust the procurement database, or what we can create to track sustainability performance when it comes to purchasing before introducing the goals. And most likely the goals will be aligning with, again, LEED. So far we have done products. We have our effort included by product, where we converted all of the sick kits to be, for the paper to be sustainable green paper. our cafeteria, 85% of it aligns as compostable or truly recyclable items that are used within our cafeteria. RFPs mention the sustainability criteria, the environmentally preferred purchasing policy. When it was implemented, it was done jointly together with different departments, and procurement owns the policy. We have our the criteria for some of the products, sometimes high level. I think we still need to do more work in assigning weight to the during the process, during the RFPs. Our redevelopment group, which is responsible for many of the renovations and the new development, use the environmentally preferred purchasing policy and the criteria during their planning, and they have shared with their construction consultants and vendors that this is our policy and to align it as much as we can. Our next policy is green cleaning policy, and I mention it because we do focus, there's a big component of purchasing, and we were able to define goals and to track how we're performing against our goals under the green cleaning policy. And although the policy does focus on purchasing, it includes so many other areas where, how the staff should use the chemicals to clean, how the staff should store them, and how to select the products, and how to sometimes maintain certain areas of a building to ensure that we reduce our environmental impact. So that's why I kind of list out all the other categories that are also found within the green cleaning policy. So we do have goals that we're meeting and working towards them. So our cleaning products and materials purchases, our goal is 85. And we know at the hospital, we are around 95% at the moment when we track, and our research facilities meeting at 87%. Cleaning equipment purchases, it helps us to meet this goal by us being at the table when purchases are being made for capital and other products. The cleaning equipment inventory, although the low goal seems low, when you start looking through the criteria, and I'll provide some examples of the criteria that we're trying to align, the sustainability criteria, it's not as easy to find some of the equipment that'll meet the criteria, as well as we have the toxic chemical usage goal of using only when it's really absolutely necessary. So examples of some of the sustainability criteria in our green cleaning policy includes the green seal, the eco logo. Also for most of the equipment require a maximum sound level of 70 dBAs. But also an example of vacuum cleaners must be certified by the Carpet and Rug Institute, seal of green label vacuum program. So these are just some of the examples of our sustainability criteria in the green cleaning policy. So just a little.
Excuse me, Elizabeth, I'm just sensitive to our time. So
Okay.
we'll just ask you to try to wrap things up so we can give Ian a little time to present as well. Okay.
That sounds good. Sounds good. I'm just going to wrap up with saying that we had a huge success with water, reducing water. And we did this primarily through, one of them is preventive maintenance to fix water leaks, monitoring to avoid use of city water. And I'm going to leave it at that. Thank you.
Excellent. Thank you, Alida. That's a lot going on there, and congratulations.
Thank you.
I should mention, we're going to have, you want to go back to Ian, Autumn, and we'll give Ian, who's the Senior Director of Facilities Management for Holland Bloorview, a chance to say a few words.
Great, thanks. I don't have a presentation. Time restraints got in the way, but I appreciate you allowing us the time to.
Sorry, Ian, if I could just interrupt for a minute. If any of you have questions, you can put them in the Q&A, which is in the bottom of your screen. for Alan, Ian, or Elizabeth. So
Super.
go
Yeah,
ahead.
so I didn't get a chance to put
Hold it.
together.
I didn't get that. Could you try it again?
Oh, sorry. So I'll just get, for those of you who don't know, Holland Bloorview Kids Rehab has a history dating back to the latter part of the 19th century, when thanks to the foresight and determination of a group of dedicated women, a facility for children with disabilities and chronic illness opened in Midtown Toronto. In 1899, 22 women gathered for tea one afternoon to discuss the establishment of a facility dedicated solely to the care of children with chronic illness and physical disability. This was not your average group of women, as 18 of those in attendance were founding members of the Hospital for Sick Children, now known as one of North America's largest children's hospitals. It didn't take long for matters to evolve, and on December 16th, 1899, with the help of contributions, donations of furniture, and a 2-year rent-free agreement for its first home, the Home for Incurable Children opened its doors, ready to accommodate 15 children. Obviously, we've evolved over the years, and the hospital has underwent significant changes through the generations, with many locations and name changes along the way. What hasn't changed, though, is the support of caring, compassionate community whose contributions have helped create a world-class hospital with a vision to create a world of possibility. So much like my two colleagues demonstrated with their presentations, this past year, a lot of what we've tried to do, though in the midst of construction and also surviving the pandemic, as we all have been doing, is really looking at how we can use our existing systems to manage our water use, our energy use, as well as manage waste. We've incorporated actually artificial intelligence through our support services supplier, Sodexo. We're actually piloting it right now, which, if you can imagine, kind of examines what you're going to throw in the garbage and kind of tells you where to put it. Because I think that's a lot of the challenges that we have in facilities management, regardless of your sector, is waste diversion, people putting things in the wrong bin. We also improved the signage at all of our bins to really focus on what we actually have as waste coming out of our cafeteria or Tim Hortons. So there's a visual cue as to what should be going in each bin. So I think that contributed quite a bit to our diversion numbers being quite high this year. In addition, with the renovation project that we undertook, as well as the addition, we asked our contractor to follow the LEED principles with waste removal. So all of the debris that came out of the renovation was sorted to a LEED standard, so that we could divert all of those materials appropriately and reduce the impact on the landfill. Overall, like with energy management, again, as I mentioned, using our building automation system and the computerized systems that control our chillers, our boilers, and major energy consuming equipment, is really fine tuning how we deliver heat and cooling, and engage with end user departments to ensure that if we change a temperature by even one degree or 1.5 degrees, they really don't notice. But what we do notice is a significant decrease in our power consumption and water consumption, for that matter. So at this stage, like the building that I've been lucky enough to inherit is not an old facility. It was commissioned in 2006. So a lot of the technology that we have is quite modern and has that ability to allow us to fine tune and find ways to improve efficiency just by changing how we're operating the equipment or increasing the temperature by 1 or 2 degrees. With regards to policies, like we're in the process of updating our strategic plan for the hospital, and my VP, who's our VP of Corporate Services, People and Innovation, is sort of the executive champion that would represent sort of green initiatives and sustainability. And one of the things that I certainly wanted to have listed as a priority for Holland Bloorview is finding ways to incorporate sustainable practices, green procurement, and other programs that get the support of the entire executive team and allow us to promote and advertise these programs across the hospital. So But I'll leave it there. So just really pleased to receive this award, and thanks for everyone to allow me to share a little bit about our hospital, and congratulations to all the other participants and winners.
Thank you so much, Ian, and I'll echo that comment. Congratulations to everyone. We have about 3 minutes for questions, which you can put in the Q&A. But also you can also email those questions to us, and we'll try to answer them. If you here's some contact information. But also I wanted to say congratulations to all of the participants in the program. You know, without your participation, it really wouldn't exist. And so we're so pleased that 99 sites across the country have been able to participate in spite of the fact that COVID has been raging, and we know it's a lot of work, but we think it's well worth it. So so thank you. Autumn, there's some other final comments you wanted to make?
Yeah, I just wanted to say thank you again for to our panelists for being here today and for speaking, and thank you to all of our attendees for joining us and listening to what we had to say. And I'm excited to give you all updates about our next scorecard when they become available. And to answer one of the questions, we will be sending out this recording to all registrants, and it will be posted on our website and on our YouTube channel at a later date. And Mike Apostle just had a question. What are strategies to get executive team sponsors for sustainability initiatives?
Actually, maybe I can speak to that, Autumn. We actually come in about a month or two, we'll be circulating a guidebook for senior leaders, boards, and medical staff. So look for that, and I think you'll see some suggestions in there.
Yeah, and I'll be releasing that through our digest as well, making it available, and it'll also be on our website as well at a later date. So keep an eye out for that. Just a reminder, we do have our Energy Awards presentations tomorrow, Energy and Energy Behavior Awards. So if you can attend, you can still register, and I'll be sending out the webinar recording for that as well. Link should be available to you through your email, through the website, and through our social media as well, or you can email me if you cannot find them. All right. So thanks
Okay,
again.
thank you. This concludes the webinar.